Leeds, Leeds, Leeds. What is happening? Welcome to Working Hours, an oral history podcast about a place called Leeds, a time called now, and an activity called work. Working Hours wants to record 1,000 loiners over the course of this, the most important decade in the history of the human species, and ask them about what they do all day and hear how they feel about it. My name is Simon, and this is all my fault. My mission here is to try to map out what my city, Leeds, a city that has declared a climate emergency, did during humanity's biggest emergency. On Working Hours, we hear how loiners have, are, and will be coping with our multiple and expanding crises during their day-to-day working hours. Can we turn things around? We'll find out. To tell this story, I need loiners like you, dear listener. I need people in Leeds or people from Leeds to come on this podcast and just tell me what they do all day and let me record how this affects us. Thank you for listening. What did you want to be when you grew up?
I actually wanted to be a doctor. Yeah.
How far did you go with it? Did you get as far as medical school, or did you change your mind before then?
Nursing.
Nursing.
I did nursing instead, but it was after I got my nursing admission, I started the program. I got an admission for to study medicine, but it was just too late. I just decided to stick with the nursing. Yeah.
2 million people in the UK are living with sight loss that is severe enough to have a significant impact on their daily lives. Half of this sight loss is avoidable. This year's National Eye Health Week is taking place from the 18th to the 24th of September 2023, promoting the importance of good eye health and the need for regular eye tests for all. You're listening to a special bonus episode from Series 4 and to my guest Farida Ali. This is another Zoom interview recorded on the 18th of September 2023. Farida Ali has a background in public health. Currently, Farida is working for the charitable organisation, the Association of Blind Asians Leeds, or ABA Leeds, as their community engagement coordinator. Her primary focus is connecting with diverse community groups across Leeds to promote eye health and the eye health services provided by ABA Leeds. Farida also plays a vital role in establishing and cultivating partnerships with other organisations in Leeds, working collaboratively to advance ABA's mission. Farida contributes to event planning and for the interim takes charge of their social media management, ensuring that outreach efforts are effective and impactful and making a positive difference to the eye health of communities in Leeds. Right, let's do this. Episode 94 of Working Hours with Farida Ali. So I'll jump straight into what are you doing now then?
So right now I went into the public health field. So I dropped nursing and I studied public health for my master's. And right after that, I went into my current job, which is like an health awareness. So we are more focused so I'm the community engagement officer. So what I do is engage with communities, spreading awareness about health issues and eye health conditions.
So are you employed by one of the NHS trusts or NHS England, or is it like a third sector?
It's a third sector. Charity is a charity organization, but then it's based on promoting eye health. So it's called ABA Leeds. That's where I work at the moment. Yeah.
So, I imagine they have to they have to apply for a pot of funding each year to do programs and...
Yeah. Based on charity, yeah. But we work closely with NHS and other organizations.
Yeah. So what's your kind of day-to-day like? Is it largely going out into the community and working with groups, or is it more attending meetings with various health sector professionals? Like what's your sort of week?
Yeah, well, so I go to events, mostly everyday events, partnership event, networking events, because you need to network with people so you could, work together. And I work closely with communities as well, community groups. I go to community groups and give an eye health awareness talk. I give them like a presentation so they could know what to do, take care of their eyes and make sure their health is in check. And I also talk about our services that we provide to people. who are visually impaired, because we support people who are visually impaired. So I just go around, we want to work closely with people who support like mental health organizations as well, because eyesight loss, mental health is almost in the same hand to hand. So yeah, we just work closely with everyone. So I'm mostly networking and also working with communities across Leeds.
Yeah, getting your name out there, establishing like, I'm the person doing this and I work in your area. I should know you. You should know me.
Yeah. Mostly that's what I'm doing at the moment.
Yeah. So you would have come into this role after lockdown, because we were saying before that you've not been in the role.
Yeah. Before lockdown, I was still a nurse. Mm-hmm. But yeah, after lockdown, I started the role after lockdown.
Okay. So I imagine with your role that there is an element of social media to do with it. Is that left to you, or do you have someone that works on it, or are you you're in the development worker role, and then you kind of have to do everything basically, like make the role work?
Yeah, well, with social media at the moment, I'm not supposed to be the one in charge of all the social medias, but the lady we had, she had some family emergencies, so she had to be off at the moment. So we're trying to get someone else. But at the moment, I am in charge of the social medias and social media at the moment.
Does it take a lot of time up for you, or?
I don't think so. I mean, I think I enjoyed it. I enjoy it actually. Yeah, I find it. With social media, it's just you just get a lot of information, and you get your information passed across as well. So it's a two-way thing, which is quite good. Yeah.
And are you finding it quite easy to find the organizations that you need to know in the city, or is that a bit of an effort?
No. It's just really easy. I mean, all you need to do is just go to Instagram or Google, just search for the organizations you're trying to find. You see the name, you find their links to the socials, and that's how you just get it going. So it's quite easy.
Yeah. I mean, was that something that you kind of expected to be spending time on, or your work time on, as you went into the role?
Well, because the role, there are two things involved in my role. The fact that I am actually new to Leeds, which means I need to do a lot of research on communities across Leeds, organizations in Leeds, and all that. So social media has been a way to help me find it. So I am not finding it difficult, because I'm also educating myself as well as doing my work.
Yeah.
If that makes sense.
Yeah, it's like a steep learning curve.
Yeah. While I'm still doing it, I'm also getting more information about other organizations. So
And are you office based, or is it a hybrid role? Like, do you work from home much?
I'm actually office based.
Yeah.
I wish I wasn't more. After COVID, everyone just wanted to, I can work from home. But time to time, I actually do work from home, but I'm more office based than a hybrid. Yeah.
Do you prefer to work in the office rather than at home?
I think there's a pro and con to working in the office and working at home. I must say, sometimes it's just better if you work in the office, because like if you want to talk to your manager or your line manager or any other colleagues, instead of sending an email, I will literally just go to the office, knock on the door, go in and say, oh, can you help me with this? Or how do you see this? It's just much easier. But while online, it's either you email, wait for a response, or you would have to call them. And if they don't pick the call, then you have to wait. That's just it. But I think it's more, everyone wants to work from home because it's more convenient for people. Like, you're just more relaxed. And the thing is, you still get your work done regardless. But in terms of emergencies, office spaces would be better.
So on the community work side, have you been able to access the sort of groups that you need to access yet? Like, have you made those connections and sort of already started that? Yeah.
I have actually. I have been doing quite a lot of networking, attending events, and from there you just talk to people, and that's how you just keep meeting organizations, and you just have contact everywhere. And I'm getting, it's quite good. It's quite good. We're getting there.
Yeah. And so I would assume that you have your own sort of specific project and certain metrics that you need to hit for this project that you kind of go on? Sorry.
Oh, sorry. No, for me, it's more about networking. And then when we organize events as well.
Mm-hmm.
So we had few events, so we go to different pockets in Leeds, and we try to make a eye health awareness, inviting other people, like other organizations to come with us. So people from the community would come to the event, and we give information, we provide support to them and tell them where to look for support, signpost them if we have to. In part of my role, I organize events, coordinate events as well. I also need to be in the communities. And it's part of my role to network as well. Networking and partnership, building partnership and maintaining the ones that we have.
Yeah. So I'll go to the climate change one first. So the question is basically how it affects your work. And part of the reason I ask is, well, number one, I'm interested, and I think more people should talk about climate change. Number two, Leeds has declared a climate emergency. So I think it's a valid question for working in Leeds in the 2020s. So is there anything that you can do in your work in terms of mitigation, adaptation, or sort of, raising awareness around climate change?
My work is basically, it's focused on the communities, and we are basically more focused on providing support for people who are visually impaired. So we're not really on the climate change sector yet, but we do, whatever we do, we try to make sure that we're keeping everything climate friendly, environmental friendly. That's what we do. We have shredders. We make sure everything is recyclable. We make sure we get all our recycles done, and, just making sure that we are doing our own part to make sure that we're keeping the balance at least. But providing awareness about climate change, we haven't gotten there yet. Hopefully we would. And I mean, with the way everything is going, I think we would have to start making sure that we're getting people raising awareness about it. Hopefully so.
Yeah. I mean, I don't know with the contract or the funding, I don't know if there's any kind of green element that they might have put within there. I don't know if you've seen it and whether you know.
Well, I have seen it, but it's basically for, because, there are charity organizations that are really supporting, that are into the climate change. I've seen fundings for their climate change actions, but because ours is not it's not really targeting that. It's more on the visual eye health and visual impairment, supporting people. So we can't really go into it yet because that's not what we do. But we can make sure that we are doing our part to support it.
So let's do a little bit on the eye health then. So is there a top three most common conditions that you want to raise awareness about, or ones that are preventable, or is it more these are easily treatable? And what are your kind of top tips, or some give us a kind of eye health tip of what should people be doing? What should be the number one thing people do to take care of their eyes?
Get your eyes checked, because I think everyone thinks until something, maybe I am feeling my eyes is getting a little blurry or something. That's the only time people go to the hospital to see their ophthalmologist. And that's not how it's supposed to be. You're supposed to go see your eye doctor every 2 years, regardless of how you feel with your eyes. It doesn't have to be when you're having problems with your eyes. That's when you see your doctor. That's what people don't know. And secondly, there's this condition called diabetic retinopathy.
Right.
It's when you have diabetes and it's uncontrolled, and you also have blood pressure, unregulated blood pressure, unregulated diabetes. It can lead to damage of the optic nerve. So people don't know that if you have diabetes and blood pressure, you could be at risk of having that condition. So we tend to raise awareness about that, because we know a lot of people, especially in the ethnic communities, there are lots of rise in diabetes and blood pressure as well. So we try to spread awareness about it, just so people would know, and make sure they're keeping the balance, making sure their blood pressure isn't checked or taking medications for it, diabetes in check and taking medications for it to prevent that. And secondly, we always support exercise, eating healthy, preventing your eyes from the UV ray. When it's too sunny, wear sunglasses. When you're doing a DIY, make sure you're wearing the goggles to prevent your eyes. For ladies or anyone, if you're wearing makeup, make sure you don't share your eye tools with anyone else.
Mm-hmm.
Yeah. So just maintaining your eye and eating good food, leafy foods, greens, salmon, and just making sure that it's in check.
Yeah.
And omega-3 as well. Very good. Yeah.
Yeah. So largely, keep healthy, keep your circulation healthy.
Yeah. Yeah.
Take care of yourself as much as you can.
Yeah, that's it.
So is it very much prevention focused then? So you're very much like looking at risk factors and looking to intervene and be preemptive.
Yeah,
right?
yeah. That as well. That and also for people who already have the cataract or glaucoma, what we do is we support them by helping them out, especially people who are partially blind, or because cataract and glaucoma, if it's detected on time, you can get it operated, get it done, and you'll be fine. But then if it's not, then it becomes a bit serious, but it's also treatable.
Yeah.
So 100% treatable. Another one before I forget, there's this one called age macular degeneration. It's called AMD. So AMD is only, the risk factor is for people who are smokers, but at the age of 60. It only happens when you're at age of 50, 60s.
Right.
And people who, it happens that people who are at risk of the disease condition are mostly older people at the age of 60, and they have a history of smoking. Yeah. So we also tend to tell people, reduce your smoking, your alcohol intake, making sure that at least regulated for people who can't just abstain from it.
Yeah.
Well, I was going to say, I was thinking about how we support people who are visually impaired. We're talking about the awareness part, and I said we also support people. So we support them with benefit. We help them out with railings in the house, making sure their house has the safeguarding measures, making sure that they're not at risk of falling due to lack of some support, and just making sure they're comfortable in their home, and getting them with all the benefits that they could get from the government.
Yeah. So there's a social prescribing service to it as well.
Signposting with it. We work closely with the social prescribers as well.
Yeah. And there's quite a few of those sort of organizations now. Are you quite familiar with, I guess you've networked with them as well across the city and making sort of links with other workers in other groups? Yeah,
we do. Yeah. I mean, we're still in it, but yeah.
Do you feel, I mean, this is a fairly difficult question and we can always cut it out if you want, but do you feel that you are, because it's a really difficult area to work in, because you've got to do all the kind of admin paperwork stuff. You've got to do all the footwork. So you've got to grind a lot to kind of get anywhere. And do you feel like you're able to do the work, or do you feel like there's so many other things that you have to do to get to the work? Like, or is it quite a good balance where you're sort of like, I am doing all this other stuff so that I can do the work, but ultimately I'm doing the work?
Well, the thing is I have to make it based on priority. Yeah. So based on what is more important at the moment. Yeah. So whatever I need to get done, let's say for now, the fact that we have the Eye Health Week, this is from the 18th to the 23rd is the Eye Health Week. So for now, the most important thing is making sure that I have a radio station interview, and I have a few things to promote for the Eye Health Week. So everything else will just have to wait until after I'm done with that. So that's good with priority. So every admin work would have to wait until once it's over, I can just go back to it and make sure that I get everything done. As long as I am getting it done and going back and making sure I balance everything up, then that's the good one. Yeah, it's just order of priority. I just have to make sure that I'm getting it.
Do you take your work home? Are you quite good at sort of work's work and I finish there, or
I try my best to not take anything home, just leave it till the next day.
Very wise. So we've done social media, we'll do Brexit because I know that's going to be a short one. So the question here is about sort of noticing any changes in your work because of Brexit. And as you said, you weren't working in the UK before Brexit.
Yeah.
So, I mean, is there anything that you're aware of? Has anything come up in your job that's like, oh, I can't do that because of Brexit? Or anything that you can do now because of Brexit? Has it occurred in your work at all? Have you come across it?
No, not really. I haven't come across it yet.
Yeah.
The only thing is, I mean, the travel, well, for me, I don't know for other nationalities, it's just the travel because it was easier to travel when there was number because you could just go anywhere and discover. Yeah. That's the only thing I wish. I wish it wasn't there so I could just go around. But now you have to do the paperwork and everything else. But
yeah. More forms to fill in.
Yeah.
We'll go on to COVID.
Mm-hmm.
So I don't know, like, this could either be an area we spend some time on, or it might be quite short. Generally, my question is first of all, I ask people to kind of look at how their work changed going into COVID, like whether there was a big increase or whether it all dropped off, because it seems to be you either ended up doing a lot more or nothing at all.
Yeah.
And then sort of being in lockdown and then coming out of lockdown into work. So you've only recently finished your study, is that right?
Yeah, I graduated in last year, December 2022.
Yep.
Yeah, I graduated in 2022, public health. But I was actually at home when COVID started. So I stayed at home with my family. But then COVID really did a positive and negative aspect to COVID. Positive in a sense that we all had this, is like a rebrand or reswitch. We just have a weekend call, meaning I just decided, well, the nursing, I mean, for my career, it changed. It helps me with my career as well, because I was like, yeah, I want to be part of, well, I love working in the hospital. I love the health sector, which is why I've always stuck to it. But then I was like, yeah, I need to be out there with research and doing some work that would actually help people.
Mm-hmm.
I'm still interested in doing some research, but at the moment I'm just working here until then. So yeah, I'm still interested with research and analysis and all that. So yeah, COVID helped me figure out, okay, this is where I want to go. Because during COVID, I think public health was one of the biggest aspects. Like they helped everyone with how to prevent yourself from COVID and everything else. It was quite good, and I was like, yeah, this is where I want to be. And at my work, I wasn't there, but I heard a few things, which is because we work closely with people who are visually impaired, which means most of them are a bit at the 60s, 70s, 80s of age. Yeah. We actually lost loads of service users, meaning not lost as in lost, but then some of them are not, and they don't want to go out anymore due to the COVID, due to the whole
they're
COVID
scared
thing.
Due to the risk.
Yeah, they're scared to come out. They're scared to come out due to COVID. We have like a luncheon groups for elderly people in different areas across Leeds, but we had a massive reduction in people that come to the groups due to COVID. Yeah, there's a lot. We had a lot of there was a decrease in participation, but I think we're picking it up now gradually. Yeah. But yeah, we did have. I wasn't there, but I was told about it.
So I guess was there anyone sort of in your role like last year or before you? Basically, did you take over from someone, or did you just come into the role and?
No, I think picking everything up. I'm actually the first person on the role. It's a new role. Yeah. No one had no one had the role.
So did you have anything to start with? Did you have any, like, have you had to basically start all of this from scratch and just...
Yeah, I started networking from scratch, everything from scratch, literally. But yeah, it's actually going great.
Yeah, I mean, it gives you... I mean, it can be overwhelming because you're kind of like, well, where do I start? But
Yeah,
I mean, you're a
yeah.
few months in now, so you've got things going, you're starting to
Mm-hmm.
know people,
Mm-hmm.
and you've done all that work. So that's like, you get a sense of achievement from like, well, I'm actually being effective
Definitely.
now.
Definitely.
I mean, from the healthcare side,
Mm-hmm.
do would you rather be like directly patient facing and spending time with them, or do you like this combination? Have you got like a nice mix at the moment, or would you prefer to be more kind of policy side, public health side, more planning and strategic rather than, up there with the people? What side of the
Um,
job do you prefer?
well, I think I got tired of the patient side, which is why I was
Mm,
like, yeah, I needed to leave. I am on this side. It's not bad. I'm enjoying it, but in future, like maybe I'm still looking. I would definitely be going into the policy side and whatever. But I think it's best. It's all about meeting experience.
mm,
Yeah, that's what I believe. I did the patient side, so I know how it feels
yeah,
to be part of the patient, like a patient and a health worker relationship. I
yeah,
know how everything goes. It's not like I'm just seeing it from everyone else's view, but I have
yeah,
been part of it as well.
yeah,
And being on this side is also an experience. So going further, if I'm going further to the policy side, I have a side of what's happening with patients, what's happening in the community, and also it's just like a build up to
yeah,
that. Yeah, but I
yeah.
would love to be there eventually.
I
Yeah.
mean, like one of the things, part of why I asked that is,
Mm.
you can see, say if you're doing some public health at scale and you're looking at figures, facts and figures, and you can see
Mm-hmm.
a noticeable uptick and you sort of like, oh, that's good. We've made all of these health
Mm-hmm.
outcomes better, but it's still not quite the same as seeing someone that you've had in direct experience with where they're getting better and you've added
Yeah.
to that care.
Yeah. Yeah. Yeah.
So I'm wondering if you will get to a point maybe where you're like, this, no, I need to be back with the patients. I need a real outcome. Of this is meaningless to me. Like, do you get pleasure from that, from seeing, like, I mean, obviously you do, otherwise you wouldn't be doing
That
the role.
yeah, no, no, no. I'm best tell you is it's really amazing working with patients
Mm,
because it's really good. I've had a few people that have come up and like, you are so good. Thank you so much for everything. It's really, really, it feels so good. And even working here, I've had people that I helped signpost to other organizations and they were able to get their support and everything else,
mm,
which was really good. I got a call, they called me back and they're like, thank you so much for everything. And I'm like, yeah, it really does feel good.
mm.
But for me, in the hospitals and everywhere else, I love it. I enjoyed it, but it's just that sometimes it can be a little bit overwhelming.
Yeah, yeah,
It can be a lot, actually. It can be a lot
yeah.
overwhelming. And for me, I had a bit of an experience with the healthcare,
Mm,
not here, though, not in the UK,
mm,
in my country where I came from. So it was a bit, the mental health,
mm.
it was just, I had to think about it. I love it. I enjoy it, but I would rather be somewhere. And I want to have a balance.
Yeah,
I want to be able to have my weekends as my weekends,
yeah, yeah,
have my days off as my day off, and just have little bit of balance. But when you're working in the hospitals, you don't really, I mean, you could have the balance, but then it's not really as
yeah.
flexible as when you're working at 9 to 5. And I actually just went working 9 to 5, to be honest. I think that was it. There was a lot to it. I mean, there's a good and then, yeah, it's just
So
that.
were you doing like on your, so you're training through COVID? Were you doing like practical experience? Like, were you working in hospitals through that?
Yeah,
Yeah,
yeah, yeah. I was actually. I
yeah.
was. I was.
So I mean, I imagine that was hell. So
It
I'm
was.
not
It was.
surprised.
It was draining. It
Yeah.
was really draining. Yeah.
So yeah, I mean, after that experience, you're gonna need you need to take it a bit easier, I think.
Yeah.
Um,
Definitely.
yeah. So that's the COVID question, isn't it? So we kind of done COVID. We're going quite quick, but that's fine. We'll go into the change question.
Hmm.
So I think this might be quite interesting from you because obviously with that kind of role, I know with those sort of roles, there's always stuff that like you need, but you can't get because you haven't got the budget for it or whatever. It's like, I would really love to have this. It would make my job so much easier. So the question is, what three things, if you could change any three things about your work, what would you change?
Can I say endless budget?
Yep.
When the budget is with budget comes restriction because you can't do a lot even if you want to. Meaning, we would like to have it. Some people, well, after the whole thing, like there are people that want to come to our events to get knowledge and education, but then we can't bring them in our own car because of safety measures.
Yeah.
And they're having struggles with transport, meaning they can't just use the bus because they have other health conditions. So it's either we use the access bus for them, or if we could, I would love us to have like a transport system where if we have events or everything, they can just go pick everyone up and bring them. They would get whatever information they need to get, take them back, and we know they are safe. That's one thing. Another, I would like us to have the whole accessibility and inclusiveness, meaning becoming more bigger. Because right now we're just like a small charity organization, and we're just focused in Leeds itself. We have people calling from Bradford and other part of West Yorkshire, but we can't support them because we're only based in Leeds. So I would love us to expand to the other part of West Yorkshire as well. Thirdly, I would like to, collaborate with bigger brands, bigger organizations. I said brands, bigger organizations where we could really, really work together, like partnership, and we could support each other like really well. The big ones that people know. What else would I wish for? I mean, if we could have endless budget, that would be great. That's everything answered, really.
I mean, it lets you do anything you want then, doesn't it, really?
It gives you everything, literally.
A blank check, please. That would be great.
I mean, what would you do? I'm going to give you a black card. Here you go. Do whatever you want.
You'd probably get distracted and be like, "Oh, you'd spend all your money on stationery and making the office comfortable."
Actually,
you're like, "Oh, the work! I forgot the work."
Too comfy. When you get too comfortable, then you forget the work.
Well, it is good to have some restrictions because it does make you creative, doesn't it? And you have to prioritize, kind of like what's going to be the most effective thing for me to do cost-wise.
No, it's actually definitely. I agree with you. It was good to have, and it's keeping you in check so you don't go overboard. But then if you're also able to have the more important things, because for us working with other people, we know what their challenges are, and some part of it we can't do anything to support them. I wish in that moment we'd be able to have somehow, somewhere to support them and make sure that they have access to whatever we're trying to do. That's just it.
Cool. So the final question is the UBI question. We're going to come in under an hour. So are you familiar with universal basic income?
I did my research.
So this question's kind of, again, a lot of people aren't familiar with universal basic income, so I kind of want to promote the idea. And the main thing that people say, or the main argument used against it is like, if you gave it to people, people wouldn't work. But everyone I've asked would still work. So they might be lying, but they've said they'll work. So it's also to kind of ask, what would you do if money wasn't kind of an option? It wasn't an issue, it wasn't a problem.
Well, is it for me or for work?
So it's for yourself. So if there was a universal basic income, so you're getting an amount of money, like each month. So that's a helpful amount of money, not just, here's a tenner. So would that change your work at all? Would you feel less need to work? Would you work less hours? Would you still stay in the same job? Would you stay in the same sector? Like, how might it change things for you?
Okay. I think I would stay at some point, but I think I would go into what I actually wanted to do. Like, even though I love the health sector and whatever, I actually do have a passion for fashion and all that. But I feel like I'm just, when you kind of keep discovering yourself as you grow older, right? I know I always had it, even when I was a child. I've always loved the whole, like anything that has to do with dresses, fashion, or whatever. Like I've always been a fan of that. My parents would be like, you know what, you need to figure out what you need to do in your life. You can't keep changing career every few years. So if I do have like a support, I would actually go for what I want, which is like going into the fashion industry. I love fashion, I love photography. I'm actually good at it, but it's the fact that I know that, it's something that I want to do, but then I have to make sure that I am also doing the work that brings me money first.
Yeah. Do something sensible. Get a trade. You need something secure.
Yeah. Secure myself. And then eventually, maybe at some point, I would go into it. But at the time, I'm just keeping it on hold. Yeah.
So do you sketch? Do you draw? Do you design anything sort of in your downtime?
I'm more of like a stylist kind of person.
So sort of working with fabrics and then you just kind of shape things, or?
Not really. I'm more like a curator. So I could see any outfit or whatever, like just go to a shop and I could just see some items and I know what would look great on any other person. Like my sisters and everyone else would call me, oh, I don't know what to wear. I'd say, show me what you got. Oh, this is all I have. Okay, wear this and doesn't. It's like it's
like
called
a stylist.
Yeah, like a stylist. So I think I'll be really, really good at that. But I mean, I am trying my best at the moment, and anything that I wear really looks good. So I have a good fashion sense. That's actually good.
Cool.
Yeah.
Well, that was an unexpected detour.
I know. Yeah.
So if there's anyone who needs a new stylist out there, and
yeah, but I think that's the only one thing that if I would go into at the moment, and I think I wouldn't change that anytime soon, because I know it should have been something that I have done in a long time. But you know how our parents, well, I don't know, for me, my parents are more like, you need to have like a concrete job. They don't see fashion and everything else as actually a job. They see it as something you do in your leisure time or whatever. Yeah. So that's why they were like, oh, you need to make sure you have a concrete job. And for them, concrete means doctor, lawyer, all the big ones, finance, accounting, whatever. Yeah, that's what they see as that. Fashion wasn't one of them. So, yeah.
Yeah. Well, I mean, getting a profession, it's steady work, isn't it? And then once you got that qualification, you can kind of almost work anywhere in the world, and then you will get work. So I mean, it makes sense on a lot of levels, but that's a lot of time to put into something, isn't it? And then once you put that amount of time in, I mean, you must feel like, well, I've got to do this for at least X amount of years, because otherwise you kind of wasted the time training. You've got to get something out of it.
Yeah, I mean, if for something, if I could have like a balance where I could do this and also do whatever it is I want to do, then I'm fine, actually. It's all about balance. If I could have a balance of working my actual job from this time and then have a balance to doing the fashion thing or chasing whatever I need to do, just have like a little bit of balance. For that, you could do it anytime, anywhere. But for the job, you have to be present. So that's just it. But if I could have a balance, then I would actually do both. Because I still want to work in the health sector.
Yeah. You're not even after the COVID experience, you're not put off yet.
No, I'm not put off. That's why I said, like, even my current job is I'm working for the health sector, but then like a third party. I don't mind still being in the third party, but maintaining that and also getting whatever it is I want to do. That's just it.
I mean, I suppose based on this role, but it'd be great if you could make some sort of argument of, well, great styling is really good for your eye health because you're looking at more beautiful things, and therefore you'll feel happier, your eyes will be happier, and they'll be healthier.
Actually, there's a thing about eye health and what you see affects your mental health.
Yeah.
Yeah, there's that too. I actually read it up, especially now that it's coming. That said, what you see affect your mental health, which is 100% true. So yeah, there's a connection.
There will
Whatever
be
makes you happy, whatever you see that makes you happy, it's good for your mental health. So whatever makes you happy.
yeah.
Yeah.
Yeah. So, there's a great legitimate health reason to wear good stuff.
Definitely.
So, are you happy to hang on for a little bit longer? Because I've
Oh,
been through most of my
I was going
questions.
to say something about the UBA as well.
Yep.
So with the UBA, it will be a good aspect. I don't think, well, I mean, there are other people that might just decide, oh, they don't want to work at all. But I feel it's going to be okay because based on how the cost of living crisis is going on and how everyone else is struggling to get their bills and everything, it's actually a good way to support you. So you don't have to worry about having endless bills. You have tons of thousands of bills and other things that you're in debt. I mean, I think it's a good way to just make sure you're no more in debt. People in the communities, we could just shift our focus, meaning us in the charity, instead of providing them support with benefit. We already know they have some certain amount of money to support themselves. So we could channel our support into something else, making sure they have more. Well, I mean, we have to do our research at the time to make sure, okay, so we could see what are the gaps that are lacking and how we can support them on those gaps. But I think it will be a good help for the UBA would really support people, and we know how the communities are going through a lot due to the cost of living crisis. Yeah. So it will really be a good way of supporting.
And those risk factors as well, like the risk factors, a lot of them are diet factors, and a lot of that diet factor is based on, the kinds of foods that are available to you, the kinds of foods that you can buy, which are largely mass produced, full of sugar and fructose syrup and all that kind of terrible stuff.
At least you can have healthy food, meaning you don't have to worry about getting all the junk. I mean, you still have to do that, but then still encourage people. They won't say, "Oh, we don't have money for it," but at least we know that at least they could be able to get them more healthier than the whole junk. Yeah.
But you also need you need a cause and a reason to be healthy as well. Like people don't eat just rubbish food because it's rubbish and it's cheap. It's like it does give you pleasure. It does give you.
I know.
So you kind of it's joy I can afford, even if it's only temporary. So but yeah, if you could alleviate some of that and people, if you put a bit of money in people's pockets, it would have a huge effect to make people feel better, have great health outcomes.
Well, there's that too. The thing is, there's always going to be a pro and cons to everything. You just have to look at it. Meaning, is it because really and truly, lots of communities now are really struggling with financially, because we deal with them like there are some things that we could help and there are some things that we can only signpost to other people. So it will be good for those people to have that support. For other people, well, I mean, there's nothing much we can do. We can't control how someone spends their money. But I remember another point. We could have it in a way that if the UBA is in place, have a way of having like educating people on how to spend their money wisely, even though, to be honest, not everyone would stick to it. But then we could just make it provide some educations and advice on how you should rightfully spend your money.
So from pilot schemes and stuff, and some of the stuff that I've read, so they found one of the outcomes that they found was health results are better, not just because people feel a bit better, have a bit more sort of regular money and stuff, but the regularity helps people to plan. And also because they've got more time, most people have sort of more time and they don't have to use as much space in their head worrying. And so people are kind of around more, a bit like in lockdown. So if there is an accident in the home, there's someone more likely to find them, or there's someone more likely to prevent that accident from happening in the first place. So it kind of makes people less stressed, healthier, and, a bit safer. And also you're going to have more social interactions, which ideally are better. And that creates a more, a better social group, a better social bond, all those kind of things. So, yeah, I think the benefits are just great, really.
Yeah.
And I think that's why I think it needs to be sort of more widely known, because it's not even
Yeah.
something that we're really talking about. But I know that just running a UBI would be cheaper than, spend on universal credit, because that has to be means tested. So they have to go through all the, whether you can get it or not. If you just give it to everyone.
Yeah. Because we also deal with the whole UBI universal credit thing. Yeah, definitely. Yeah, it would be great. I mean, everyone loves having steady, whatever happens, at least you have something to back up on. Yeah.
I mean, they found even with people who were homeless, because they've got that regular income, like even if it's a small amount, that like they know they've got that, so they can plan. They can, like whether you want to save it up to get a particular thing, or it's like, all right, well, I'm not going to spend it now. I'm going to leave it there, and I'm going to hang on, and then I'll spend it on whatever else. But it's that ability to know that you've got something regular that you can work with. So this is kind of the section where I throw it over to you. So if you've got anything that you want to talk about, anything that we haven't covered, anything you might want to ask me, or anything to promote. So we'll do the social media and stuff first. So where can people find, is it ABBA or just
ABA Leeds?
Yeah.
We are on Instagram at ABA Leeds. So it's ABA Leeds. We are on Twitter, on Facebook as well. We're literally everywhere. Yeah. And you can search on Google if you want to go on our website. Is www.abaleeds.org.uk.
And you don't need to be worried about your eyes. You can get in touch with other people, I assume. And
yes, you can refer yourself, you can refer a family friend, you can refer anyone really that needs support with when they have a visual impairment. Any support, any advice would be able to provide, or signpost them to the right organizations to help them out. Well, I could also say we have other projects that we do. So first we have the advocacy, which is the supporting people who are visually impaired, providing benefits. Like we also have like I said, we have our launching groups that we run. And also there's this project called Ashra. So what we do is we support carers, unpaid carers, mental well-being support. We have like an activities for them just to support them with their mental health. We have a carers event happening on the 23rd, which is a Saturday. Well, I work on Saturday most of it. So we have the carers event happening. So you could come. We are working in partnership with Carers Leeds. So it's going to be an event where the carers will get information, especially in the ethnic groups, ethnic community groups. So it's just going to be, hopefully, it's going to be a good turnout, and we'll have lots of people coming for the event. We also have another project. It's called Enhance. So we support people who are discharged from hospitals. So instead of going back to the hospitals due to cleaning and doing so many stress on top of your health, we have people who would come to the house, help them with cooking, cleaning, but they don't do personal hygiene, just like cleaning their surrounding, making sure everywhere is safe, and then just reducing the stress the patients have after discharge from the hospital to balance it out for them. But yeah, that's the projects that we have.
Cool. So let's have a bit on National Eye Week. So tell us about that. Tell us what you've got going on. I assume this is a national event that happens anyway, and then obviously it's everywhere. A great marketing thing for you. So tell us a little bit about it.
So National Eye Health Week is mainly to promote people to get their eyes checked, to make sure the hashtag for this year's event is called Your Vision Matters, because we really do not know how much our eyes are important to us until we start having issues with them. And that's what you'd appreciate. So it's really important to make sure that we get our eyes checked. We make sure we have a healthy lifestyle and healthy lifestyle, and making sure that whatever health conditions we have, we're getting them in check, meaning diabetes, blood pressure. Yeah. So it's just about creating awareness. There's going to be conferences in Birmingham and other places. I'm not going, but I know some of my colleagues will be there. For me, what I'll be doing is I'll be on radios, I'll be on live, IG Live, I'll be on another radio station, I'll be on 2 radio stations, IG Lives, and on your podcast, and a few things. Yeah, just media. Yeah, so I'm going to be on the media side promoting iHealth, but my other colleagues will be out in conferences, and it's going to be a lot of things. But mainly it's just to make sure that everyone is getting their eyes checked and eating good.
Yeah. How do you feel about the media work? Like, have you done any of it before? Are you nervous at all, or are you just like, just work? Like, do you take it in stride?
It's just talking, right?
Yeah.
It's just talking. I don't know. I haven't been on the radio before, never. With social media, I think I'm a bit knowledgeable about social media and everything, but then being live, it's a different feeling. I haven't experienced it yet, but yeah, we'll get there.
Yeah, it'll be fun. It'll be fun.
Yeah. That will be on Wednesday, on the 20th. I have 20th and tomorrow as well. It's going to be a busy week for me, really. Yeah, it's going to be a busy week. We ideally have I think last year they had a conference, they organized a conference with that National iHealth Week in Leeds with my organizations. But this year around, there were lots of things happening before then, meaning we were too busy to do a lot. But then we decided, okay, well, if we don't, then we would have to just make it through media and attending conferences. That would at least recover our own path of it.
But I mean, it can be better sometimes. I mean, you are going to reach so many more people with a radio interview than you would with an event. And okay, you're going to reach a lot of people who it isn't relevant to, but you're going to reach more people that it is relevant to, I think.
Yeah, so, definitely.
It's a better way to go. Okay, I don't have any more particular questions at the moment. Do you have anything else that you want to sort of talk about? Anything that you want to revisit right now?
I don't think so.
Not particularly. I imagine this is a limited contract, so it's like for X amount of months, or a year, or because of the funding. What would be your next step?
I have a contract for 2 years. I think, for 2 years. After that, I think I would go into the actual public health just to see how it goes. If it's something that I like, I would stay. If it's not, then I'll come back to the community and continue. But I would like to go into the public health. It doesn't have to be research, but I would like to be on the policy or whatever side. And just so I know that I've done the whole public health side, meaning community-wise and wise. And then I'll figure out where I want to be. Do I want to stay there? Do I want to be in? At least I have all experience. That's all I want to do. It's all about getting experience, and that's what I'm all about. Having experience of the whole, and then figuring out what works best for me.
Thank you again to Farida for being my guest, and thanks to you for listening to the show. Thanks again to all my guests and to everyone who has donated or helped the project in any other way. And of course, thanks to you, Leeds, for being my subject. If you're listening to this on or before the 23rd of September, the event Farida mentions is at the Reginald Centre from 10:30 to 2 p.m. Remember to like, share, follow and subscribe to Working Hours, Work for Peace and Plan with Kindness. Okay, that's me. Cheers ears, take care out there and be kind to each other, Leeds. Working Hours is produced, recorded, edited and published by Simon Treen for Western Studios Leeds Limited. The music was The Bees from Chopin's Etudes, which is in the public domain and was taken from museopen.org. Follow Western Studios Leeds on Facebook at facebook.com/Western_Studios_Leeds and on LinkedIn, linkedin.com/company/Western-Studios. Western Studios Leeds will help you realise your podcast for only £25 for an hour of podcast work. Need podcast production, recording, editing, or any podcast admin doing? Need it all doing? Do you want or need a podcast host or co-host for your podcast project? Then get in touch with Western Studios Leeds Limited. Email makemypodcast@western-studios.com to get your podcast made. I am available to third sector organisations, small to medium-sized businesses and individuals who want to make podcasts or create other digital audio content. Want to make some fundraising case studies? Want to show off your expertise in your field? Want some help creating your show and format, or just some support learning to podcast and getting going? Whatever your podcast needs, get in touch with Western Studios Leeds. Go to western-studios.com and use the contact page to drop me a message about either working hours or about your own podcast project.